Good afternoon, Meenu ma'am.
Hi, good afternoon.
Am I audible, ma'am?
Yeah, audible.
Okay.
हम विजिबल नहीं है क्या?
Yes, ma'am. No, you're not visible.
वीडियो तो ठीक है हमारा.
You are
Yeah, it's
visible, ma'am. We
visible.
can. I can see
Now I
you.
can see. I can see, ma'am.
Yeah,
Yeah,
yeah.
you are
Yes,
visible.
visible.
I can also see, ma'am. Your video is visible.
It's visible now.
पीपीटी ओपन की थी वैसे
की हुई थी आपने?
ओपन की है
की है ना?
नहीं
Meenu ma'am, shall I start with the introduction?
Yeah.
Good afternoon, everyone. Am I audible to you all?
Yeah, you are audible.
Okay.
Yes,
Good
ma'am, you're
afternoon,
audible.
everyone. This is Sandhya this side from Hello Kids head office, and it's always my pleasure to connect with you all. Today, we feel honored and privileged to have with us highly respected expert in pediatric orthopedics, Dr. Gourav Jandial. To start with, allow me to introduce his remarkable achievements and profile. Dr. Gourav Jandial is a fellowship trained pediatric orthopedic surgeon with over a decade of experience in managing complex musculoskeletal conditions in children. Widely respected for his expertise in pediatric deformity correction and limb reconstruction. He is the first and the only Indian orthopedic surgeon selected by the Limb Lengthening and the Reconstruction Society, LLRS USA, for advanced training. His international training spans India, Canada, Japan, and the USA, with fellowship at CNBC Delhi, UBC Canada, JPOA Japan, and LRRS USA. Having served at premium institutions such as Fortis Memorial Research Institute, Indian Spinal Injury Center, and Rainbow Children Hospital, Dr. Jandial is committed to delivering world class orthopedic care, helping children lead healthier, more active lives. Today, he'll be guiding us on a very important and a relevant topic, vitamin D and your child bone health, a practical guide for every parent. Please join me in giving a warm welcome to Dr. Jandial for his first Hello Kids YouTube live session. Welcome, sir. Over to you.
Hi Sandhya, can you hear me?
Yes, sir, I can hear you now.
All right, thank you so much for the great introduction. I'm overwhelmed.
My pleasure, sir.
So I'll start by saying strong bones don't come from milk alone. Vitamin D decides how strong you will be. So as a pediatric orthopedic surgeon, I deliberately chose this topic because I see a lot of patients in my clinic almost every day complaining of knee pains, bow legs, knock knees, which is because of vitamin D deficiency. Vitamin D deficiency is really rampant these days because of urban lifestyle, increased screen time of kids, and most of the times the kids are indoor. So the purpose of this session is that at the end of this session, parents should be aware of a few things. One, why vitamin D is so important, what are the natural sources, when to check vitamin D levels, and how to prevent deficiency. Shall we start, Sandhya? I'll just walk through few of the slides so that the parents are aware about vitamin D. Hi,
Yes, sir.
Sandhya.
Start. Yes, sir. Please start. Actually, Sandhya is another call.
Okay.
Yes.
Shall I continue?
Yes, sir.
All right, great. So, first of all, why vitamin D is so important? Vitamin D helps absorb calcium, and without vitamin D, calcium is not properly utilized. Hence, it affects bone strength, growth, immunity, and muscle function. And in our studies, we have noticed that kids with frequent infections, pneumonias, usually have low vitamin D levels. And also, low vitamin D levels are associated with decreased immunity and skin problems. Now, what are the natural sources of vitamin D? First and foremost source of vitamin D is sunlight. I'll just go through the details of this. So what happens is, in our skin, the cholesterol is converted into inactive vitamin D when UV light falls on the skin, and this inactive vitamin D gets converted into active vitamin D through our kidneys and liver. So this is the major source of vitamin D in us. Apart from that, there are some dietary sources of vitamin D like eggs, fish, mushroom, cheese, and fortified foods. But one thing we need to know, that diet alone is insufficient and we need daily sunlight exposure for vitamin D, for adequate vitamin D in our body. Now, the estimated average requirements, daily requirements in our body of vitamin D is somewhere around 80 international units. And see, so in 1 liter of milk, maximum vitamin D is up to 40 international units. So even if we drink 1 liter of milk, only 1/10 of our daily requirements would be met. So, sunlight, again, I am emphasizing, is very important. Then, along with that, calcium intake is really important. As I mentioned, calcium plays a very important, vitamin D plays a very important role in calcium absorption. So, both of these, vitamin D and calcium, go hand in hand. So, daily intake of calcium is somewhere around 500 mg per day. But the good thing is, this dairy is a very good source of calcium, and 1 liter of milk contains almost 1000 milligram of calcium. Now, when should we test vitamin D? So, if the kid is getting irritable, is complaining of bone pains, is getting bow legs or knock knees, is less involved in sports, is complaining of fatigue, then uh, we should consider vitamin D level testing. Now, when should we supplement vitamin D? So, there are three uh, subcategories or groups when we should supplement vitamin D in kids. One, when there is deficiency of vitamin D, that can be identified by blood tests. Secondly, in infants, we should definitely supplement vitamin D because breast milk is a very poor source of vitamin D. And kids with some chronic diseases like liver disease or kidney disease, then also we should supplement vitamin D because, as mentioned earlier, inactive form of vitamin D is converted into active form of vitamin D in liver and kidney. However, self medication is not safe and overdose of vitamin D is harmful. So, whenever we are supplementing it, we should consult our doctor before taking vitamin D. Now, I use 5 point principle for my patients. So, first of all, as I mentioned, daily sunlight exposure is very important, and somewhere around 30 to 45 minutes of daily exposure in the afternoon is more than enough and meets our daily requirements of vitamin D. So how do we do that? We should encourage our kids to play outdoors. Apart from that, we should give balanced diet rich in vitamin D like eggs, fish, dairy, cheese, etc. We should reduce the screen time and we should supplement vitamin D only if, I am again emphasizing, only if our doctor recommends. So I'll end by saying outdoor play is not optional, it is biological and mandatory. Thank you. Now I'll be more than happy to answer any questions of the families and parents.
So this is Prashanti.
Hi.
Yeah, hi sir. Sir, my younger kid, he is with eczema, sir.
Mm-hmm.
And also like we have recently like we have noticed that he was allergic to milk. So I
Mm-hmm.
was still breastfeeding him. But
Mm-hmm.
he was three and a half years. And of course I'm giving alternate sources of calcium like guava and the custard apple. Would you be able to suggest me, sir? Do you think like he's low with the vitamin D because he's very active actually, but he's very lean? I want to stop it, and would you be able to help me like what type of milk I can give it to him,
Yeah,
please?
so there are two different things. We need to identify whether the kid has, first of all, vitamin D deficiency or not. And how can we identify? I'll again go through the previous slide. So, if the child is really irritable, complains of frequent pains, bone pains, has some fractures frequently, is not very active in sports, then we should sort of consider vitamin D levels to be checked. If the kid is fine, there is no concern from that perspective, no symptoms with that perspective, I don't think we need to worry about
Okay, sir.
vitamin D levels.
Okay, sir. And any alternate sources, sir, like for the calcium or
So
something?
yeah, so what I would recommend is give him a lot of green leafy vegetables, soya drinks, and you can give supplements of calcium because, as I mentioned, around 500 milligrams of calcium is needed every day for good health. So you can give supplements of vitamin D and calcium, but before that, I would recommend consulting a doctor so that we are sure that there is some deficiency that needs to be replenished because overdosing, as I mentioned, has its own implications and complications.
Okay, sir.
Any other question?
So what are the levels you have mentioned? Is it for the kid or for the adults, sir?
So, for everyone, does
Like,
not
okay.
matter whether it is a kid or adult, it is
Okay.
less than 12 nanogram per ml.
Okay. No, I mean to say the levels which you have mentioned, like, 400 vitamin D, 400 to
Okay, okay.
600. Yeah.
Supplements, you
Yes.
daily allowance you are asking.
Yes. Yeah.
So for kids, it is somewhere around 4 to 600 international units. For adults, it can go up to 800.
Okay, sir. And even the calcium, right, sir?
Calcium is somewhere around 500 mg for
Mhm.
kids as well as adults.
Okay, sir. Thank you.
Hi, Dr. Sandhya this side. I have a question. Like, I'm a patient of hypothyroidism, and you know that in thyroid, the bones get weaker, no? So I
Mm-hmm.
just want to know what I should take in the meals, like, because I'm 46 years old, above 40.
Mm-hmm.
So, what should I take in the meals?
So what I would recommend is take um, food that is rich in vitamin D and calcium. First of all, earlier, for vitamin D, you'll need to get a decent sunlight exposure, and for calcium, good diet including milk products, dairy products, and green leafy vegetables. These are the few things which I would add in my diet.
Right. Thank you, doctor. I request everyone, if you have queries, please ask doctor.
Sorry, sir. Again, me, it's Prishanti. I
Yeah,
have a
sure.
query actually. Like, few of my friends are facing a knee problem, knee issues, right, in 30s or 40s. So,
Mhm.
what do you recommend, sir? Because, like, that's a main problem, I feel like.
Yeah, so identify what is the reason for pain. So knee pain can be because of multiple reasons, but common reasons, if there is no pathology happening around the knee, the common reason is vitamin D or calcium deficiency. So what I would recommend is get those things checked, and if there is deficiency, then with the guidance of a doctor, it should be supplemented.
Mm. Okay, sir.
Hi, Doctor. Kalyan here.
Hi.
Yeah, good afternoon. I have a question. So, when I am exposed to in the sun, either in the afternoon or morning, so I feel tingling sensation or kind of a numbness. Is this a because of the vitamin D deficiency?
No, I don't think it would be because of vitamin D deficiency. Some people have allergy to sunlight, as in very harsh sunlight can sometimes create itchiness and redness. So,
Yes.
uh, that can be the reason for your redness or itchiness, but I don't think it is because of vitamin D deficiency. So if there is such kind of problem, then I would recommend you consulting a dermatologist to
Okay.
ensure that there is no allergy to sunlight.
Okay. Thank you, doctor.
Welcome.
Any other questions, please?
I think I everything very nicely in my slides.
Exactly. So you briefed already in in the slides itself only. I request
Uh,
again if somebody has a
Sir,
query, please.
yeah, hi, sir. Again, Kalyan here. One question. So, most of them have a common doubt here. So, we are telling that feeding egg is more better, but is it like we have to remove white or yellow or separately we have to feed, or it's direct egg?
So I don't think that matters whether we, unless and until we are not giving eggs in excess. I don't think we need to remove the yellow part of the egg, because yellow part of the egg has its own added advantages. It has good fat also in it. So if we are giving our kids one or two eggs, three eggs a day, I don't think that matters. Or we should remove the yellow out of the white. I think we should give the whole egg.
Yeah. Oh, thank you, sir.
Welcome.
So Prashanti here. I'm sorry once again.
Yeah, yeah,
Mm,
you more than
yeah,
welcome.
yeah,
Please.
that's okay, sir. So basically, I heard like the sunlight exposure early morning is very beneficial when compared to the afternoon. What do you say, sir?
Yeah, so there is no right or wrong answer, but recent studies have shown that the best sunlight for vitamin D production in our skin is somewhere in the afternoon, somewhere around 12 to 3 p.m. That is, these are the latest studies. But more important than that is the time of exposure to sunlight rather than the timing. So I would recommend uh, ensuring or recommending your kids to play outside for an hour or so, be it in the morning or in the afternoons. But the
Okay, sir.
best time to answer your question, best time as per the latest study is somewhere around 12 to 3 p.m.
Okay, sir. Okay, sir. And also, sir, I also observed in my little one, because as I said, he is with eczema, and I also, for example, you are saying like it's better to give an exposure with the sunlight, but
Mhm.
when he exposed to the sunlight, his cheeks will become very reddish, sir. Is
Yeah.
it because of the he has a skin allergy, or do you think that still, if it is like that, it's better to manage with the sunlight?
Yeah, so I think in that is a tricky situation. So what I would recommend is you should consult a dermatologist in this case, because
Mm,
sometimes that can sunlight can also cause dermatitis. I personally have allergy to sunlight.
okay.
So you should definitely consult a dermatologist uh, before processing it further, before sort of uh, ensuring that your kid is outside in the sunlight.
Okay, sir. Thank you, sir.
You're welcome.
Sir, there is one question in the chat box. Miss Varsha has asked the question, how much time do we need to stay under sunlight?
So the latest, as per latest study, it is somewhere around 30 to 45 minutes. So less, anywhere between 30 minutes to 1 hour is more than enough, provided the kid's skin is well exposed. Whenever the kid is outside in the sunlight, he should preferably be wearing a half sleeves shirt and a knicker or a half pant, so that part of the skin is exposed. Because as I mentioned, sunlight is important, but when sunlight falls on the skin, then only produced. If it is covered, then there is no sense.
Right. Thank you, doctor. One more question she has asked. Giving milk and eggs on daily basis, are they helpful for the kids' growth?
Yeah.
Right.
Yeah, but we need to know that this does not ensure that vitamin D would be enough, because as I mentioned, even 1 liter of milk contains only 1/10 of the dose of vitamin D that is required daily. So yes, milk and eggs are important, but apart from that, we need to ensure that the kid is out in the sunlight.
Any other questions, please?
हेलो।
Yeah.
हाँ सर, मैं मेरी एक छोटी सी बेटी है, 6 साल की है।
हाँ
तो
जी।
उसको जो अक्सर रात को सोने जब भी आती है ना, तो उसके पैर में बहुत ज्यादा पेन होता है।
अच्छा, तो ये कितना फ्रीक्वेंटली होता है, कितनी दफा होता है हफ्ते में, दिन में?
नहीं, तो ये जैसे जब आएगी ना जिस टाइम में, उसी
हाँ
टाइम में
हाँ।
इसको महसूस होता है।
तो
और
रोज
ये
होता
जैसे,
है?
हाँ रोज ही होता है, अक्सर होता ही है इसे।
जब ज्यादा बाहर खेलती है उस टाइम पे ज्यादा होता है, जब ज्यादा एक्टिविटी करती है उस टाइम, उन दिनों में ज्यादा बताती है, कि आपने कोई रिलेशन को रिलेशन नोटिस नहीं किया है?
नहीं, जैसे हम इसको नोटिस किए हैं, इसका ये जैसे पर डे का रूटीन है। जैसे सोने आएगी ना तो बोलेगी कि मम्मा बहुत मेरा पैर दर्द कर रहा है, पैर दबा दो ना।
तो फिर कैसे आराम आता है?
अब तो जैसे इसको थोड़ा दबा दिए, उसके बाद ये सो जाती है, फिर सुबह से पर ठीक हो जाती है। पर
अ-
ये चीज इसको अक्सर होता है।
अच्छा, और कितनी देर से होता है?
और अब ये जैसे जब इसका बेड टाइम होगा, आएगी सोने, तभी ये चीजें
नहीं नहीं,
कहती है।
कितनी देर से, कितने समय से ये हो रहा है?
अच्छा, ये हो रहा है आपको लगभग, हमको लग रहा है 10 दिन से ये चीज ये हमें कंटिन्यू बता रही है।
10 दिन। अच्छा, सो इसके दो कारण हो सकते हैं। पहला, ग्रोइंग
हम्म।
पेन इसको बोलते हैं। बच्चों में जब हाइट बढ़ती है या बच्चे
हाँ।
जब ग्रो करते हैं उस टाइम पे ये पेन कॉमन है, लेकिन हमें ये इंश्योर करना है कि ये विटामिन डी की कमी से तो नहीं है। तो
अच्छा।
मेरी रिकमेंडेशन ये है कि आप एक बार अपने लोकल डॉक्टर से मिल लीजिए। अगर उनको लगेगा, वो एक बार क्लिनिकली चेक करेंगे, अगर उनको लगेगा तो वो विटामिन डी का एक टेस्ट करा लेंगे। अगर वो नॉर्मल है तो कुछ भी करने की जरूरत नहीं है। अगर विटामिन डी कम है तो फिर हमें विटामिन डी के सप्लीमेंट्स देने की जरूरत है।
ओके ओके। और सर, जैसे एक चीज हमें अपने बारे में भी पूछना है। हमें भी
हम्म
विटामिन डी की प्रॉब्लम है। तो ये जैसे मेरे राइट हैंड में बहुत पेन होता है। तो अभी जैसे हमने टेस्ट कराया, विटामिन डी मेरा लो चल रहा है।
हम्म। तो उसके लिए आपको, अगर विटामिन डी लो चल रहा है तो उसके लिए आपको सप्लीमेंट्स लेने पड़ेंगे विटामिन डी के।
ओके ओके।
जी।
और ये कंटिन्यू, अगर जैसे कोई वर्क कर रहे हैं तो ठीक है, अगर फ्री बैठे हैं तो वो दर्द मुझे बहुत महसूस होता है राइट हैंड।
हम्म। अच्छा, आप एक बार विटामिन डी के सप्लीमेंट्स ले लीजिए, और जिन भी आपने डॉक्टर को आपने दिखाया है एक बार उनसे फिर से कंसल्ट कर लीजिए इस बारे में।
ओके।
Doctor,
ठीक
I
है।
request you if you can suggest like two, three best supplements for vitamin D.
या सो with respect to kids, or I would say there is a syrup, a price D3. You can give that to your kids. But before giving, just ensure that you have consulted a doctor. And second, if there is a need for supplements, then Depura, Depura. This is 60,000 unit nano shot. So it has to be taken every week for almost 8 weeks, provided there is deficiency of vitamin D, which should be checked with blood levels. And after that, a doctor must have prescribed before the kid takes that.
Right. Thank you, doctor. Any more questions, please? I request everyone, if you have a query, please ask doctor. I think, Doc, that was a very knowledgeable session. Very, it's very clear. Clarity is there. So I think nobody's coming up with the more questions. No, it's very clear. Actually, I'm very understanding.
All right, great. Thank you so much. I'm really sort of overwhelmed with this, and I hope I have answered few of your questions, families, parents' questions. So thank you so much.
No, sir. Thank you so much, Doctor. It's completely likewise. And really, thank you to be a part of Hello Kids, sir.
Thank you.
Thank you. Welcome, Doctor.
Thank you.
Thank
Have a
you.
good day, everyone.
Good day.
A
Thank you,
question?
sir.
Yeah,
Somebody's trying. Yeah, please ask.
हेलो। हाँ
yeah.
सर।
हाँ जी पूछिए, go on.
पहले पहले फ्रैक्चर हुआ है तो उस जगह दुखता है, तो वो विटामिन डी की कमी से दुखता है क्या?
नहीं, उसके कारण से नहीं दुखना चाहिए। आपको एक बार डॉक्टर को दिखाना पड़ेगा। यूजुअली विटामिन डी की जो कमी होती है उसमें जनरलाइज्ड पूरी बॉडी में या मल्टीपल एरियाज में पेन होती है, एक स्पेसिफिक एरिया में पेन नहीं होती है विटामिन डी की डेफिशिएंसी से। और वहाँ पे पहले ही चोट लगी है, तो मेरी रिकमेंडेशन ये है कि आप किसी डॉक्टर को जिन्होंने पहले देखा है उनको मिलिए और आगे की ट्रीटमेंट अकॉर्डिंगली लीजिए।
ओके, थैंक यू सर।
ऑलराइट।
Any more questions, please, before we wind up with the session? Thank you so much, Doctor, once again.
ऑलराइट, थैंक यू, थैंक यू, हैव अ
Thank
गुड डे
you.
Hello,
एवरीवन, थैंक यू।
I have a question.
Again, somebody
या,
has a
नो
question.
नो प्रॉब्लम्स,
Yeah,
गो ऑन।
sorry for
No, no,
yeah.
it's okay.
It is being said that these days it's not good to give milk to the kids due to the hormonal injections given to the cows. So how true it is?
Yeah, so that's a tricky question. I'm not sure
Yeah,
which cow is being injected and which not. So
yeah, yeah.
we just need to ensure that the milk we are taking is of good quality. That's what I can say. I'm not sure which milk is from a cow that has been injected or not. So no, yeah.
Okay, thank you.
But
Hello.
what I would say is do not stop giving milk to your kids just because of this reason.
Hmm. Okay, okay.
Doc, I have a
Hello.
query.
Thank you.
Hi, sir.
Yes, please.
Hi, sir. This is Shiv.
I also have a question.
Yeah.
एक्चुअली मेरी बेटी की जो वेस्ट है, वो कमर जो है, वो पूरा पेन होता है उसको कभी कभी।
Uh-huh.
ऐसा नहीं कि रेगुलर होता है, कभी कभी होता है। एक्चुअली हम उसके पेडियाट्रिशियन के पास गए थे,
Uh-huh.
तो फिर भी ये पेन नहीं जा रहा है। उनको लग रहा है कि कैल्शियम और ये डेफिशिएंसी से हो रहा है, लेकिन
कि डॉक्टर ने विटामिन डी के लेवल्स करवाया, चेक कराया है,
हाँ जी,
तो वो
उसमें
नॉर्मल
इतना, हाँ उतना कुछ है नहीं।
इतना कुछ माने कि डेफिशिएंसी है कि नहीं है?
है, नहीं है, इतना कुछ डेफिशिएंसी नहीं।
मतलब बिल्कुल डेफिशिएंसी नहीं है कि कम डेफिशिएंसी?
थोड़ा है, थोड़ा है, वो
तो
माइल्ड है।
थोड़ा, अगर थोड़ा है तो दे दीजिए अपने पीडियाट्रिशियन से मिलके, और उसी की
पोस्चर
वजह
के
से
लिए या
ऐसा
कुछ ऐसा
पेन होता
कुछ
है।
नहीं, पोस्चर वगैरह के लिए कभी कभी होता है शायद, वो आप बता सकते हो बेटर, इसलिए मैंने पूछा।
अच्छा, नहीं, ये जो आपने बताया है ये टिपिकली विटामिन डी की डेफिशिएंसी से कई बार होता है पेन। एक बात, सो विटामिन डी की सप्लीमेंट्स दीजिए डॉक्टर से मिलके।
जी।
और दूसरा,
ओके।
जब भी बैठना है कमर सीधी करके बैठना है, स्लाउच
जी।
कमर करके नहीं बैठना है।
वो बोलती है बैठ ही नहीं पता, वो सो के लेट के अपनी लिखना विखना वो करती है,
अच्छा,
इसलिए।
नहीं, उसको एनकरेज करना है उनको कि वो
जी जी।
कमर स्ट्रेट करके बैठे।
ओके, थैंक यू।
Doc, I have one query actually. I just
हम्म।
wanted to know that women after 40, like 40 plus women, should take milk is a myth or a fact actually?
Yeah, they should take milk. There's no harm in taking milk. So we should, as I mentioned, we should take good diet that includes milk also. So we should definitely take milk.
Right, doctor. Thank you. Any other question, please? Done, doctor. So we are just ending up with the session finally.
All right.
Right, sir. Thank you so much,
All
doctor,
right.
for
Sure.
giving
Thank
your
you. Thank
valuable
you.
time to Hello Kids. Thank you so much,
No
doctor.
problems. Thank you. Thank you. Have a good day,
Thank
everyone.
you, sir.
Bye.
You too, doctor.
Thank you so much.